Hi, my name is Dr. Eric Phipps, and I'm here to talk to you a little bit today about ankle injuries, and particularly sprained strains of ankles, which is very common in sports and just everyday life. One of the common problems, like I mentioned, is rolling your ankle, and it's crucial for patients to get that rehabilitated as soon as possible after the injury, so it minimizes the amount of scar tissue buildup in the joint, which ultimately leads to decrease in range of motion for the ankle and pain. What we're doing here today is I have one of my patients here that had a horse step on her ankle actually, and she rolled her ankle and tore some of the ligaments here in her ankle. So what we did as part of her rehabilitation is, of course, to adjust the ankle first and get the bones back in place. And then we're doing a technique that we call Grafton or gua sha. And it involves using this stainless steel tool here with a bevel on the end of it. So what I do first with this technique is we want to warm the area for 5 minutes. So I apply a heat pack onto the patient's ankle and we let that sit there for 5 minutes. Now what this hot pack is doing is it's increasing the oxygen by increasing the circulation. The joint now is going to turn red because of all the extra blood flow, and it's actually going to start to swell with the heat. Alright, so now we've left the hot pack on there for 5 minutes and the joint's nice and warm now. So what we're going to do is remove the hot pack. I'm going to just use any kind of lotion for a lubricant here, so make sure we don't cut her skin or scrape her while we're doing this technique. What we do is we apply the lotion there, and then we're going to take the tool and at a specific angle we're going to start to work the joint here. And by doing this motion with the bevel above the ligaments and above the muscle tendons and above the muscles, this is going to help to remove the scar tissue that's built up there in the ankle. Now if you've rolled your ankle more than one time, then you're going to have an excess amount of scar tissue on there, and we're going to need to do multiple treatments on the ankle. But we do this for 5 minutes and continue to scrape the joint or massage the joint very deeply, trying to remove the scar tissue. And for the last step of the process, what we're going to do now is we're going to take an ice pack and we're going to apply ice to the joint for 5 minutes directly on the joint. Now this part is the part that's not very comfortable for patients because it's applying ice directly to the joint and there is a possibility of burning the patient. So we have to be very careful at this step. But what this ice is going to do now, it's going to take all the swelling and the inflammation that I've put through the joint and the toxins that have built up and now are released by scraping the tendons and the ligaments, and this is going to help to suck all that inflammation back out of the joint, much like wringing out a washcloth that's been dirty after you put it in the sink. So this is a very helpful therapy that we can use on ankles, but as well we can do the same thing on knee injuries, on wrist injuries, if you've ever had carpal tunnel and chronic problems that just won't go away. This is an alternative that really helps a lot when people can't find another solution. So this is my segment for today. Thanks a lot for listening to me, and I hope to see you guys here at the office at Heuser Chiropractic, or look us up on freespinalexam.com. Thanks a lot.